Firstly, I would like to thank each one of you all for taking your valuable time in spite of your busy schedules to spare us on this occasion. And a special congratulations to Dr. Chinnababu sir for making this event a very grand success on the first day itself. So we are actually eagerly waiting for the second day to start in. So now, since we are almost in the winding up of today's sessions, the last session would be on real world use cases for AI showcase. So I would predominantly be asking, my role would be to actually ask our presenters on what are all the problems that they have solved using AI, why was AI needed for it when traditional methods are available, and also what are all the measurable impacts that it has actually caused in the real world, and how hospitals and healthcare industries can replicate it. So firstly, I would request Mr. Raja Gudepu Garu to please take over the session.
Hello. Okay, you can hear me, right? Thank you. So the use case that I will share with you starts off with a problem. The problem is there are many surgeries that happen in rural areas, hospitals across the country. And before a surgery happens, there is a surgical tray that goes, pre-op, and then the same surgical tray that is there post-op. What the surgeons want and what everyone wants is, hey, the instruments and everything that was in pre-op surgical tray should always match the post-op surgical tray, right? And we have heard some stories, some horror stories of pieces of carton missing or equipment missing, and the question is, where did they go? The best case scenario is someone left it in the trash over there, right? Or it fell down. The worst case scenario is it was left inside the patient. But regardless of what it is, you have to always make sure that the pre-op surgical tray and the post-op surgical tray equipment always matches. Now the challenge is, on top of it, on the pre-op surgical tray, everything is set in a very nice way, very organized way. So there are X number of forceps, X number of scissors, all sorts of categories of equipment. But after the surgery, for example, someone like Chinnababu is not going to just make sure that everything is organized, right? It's not his job, and they are in a lot of pressure, so things are just discarded, and they are overlapped and one over the other. And so far, that problem has been solved in a very manual manner. There was no technology that could take a picture of pre-op surgical tray and post-op surgical tray and then magically say, bingo, everything is good. Or, hey, I'm missing these two things, go check, right? So that's the problem we started talking about, and we started solving for that. We are in very early stages, so we haven't validated it fully in real world. The intent is to do that. But the results were very encouraging. And I'm not going to go into a lot of technical architecture in detail, but the amount of training data that we were able to use was very encouraging. And the results that we saw, with the models that we trained, that our teams trained, are now able to predict, at least with over 90% confidence in most of the cases, that the pre-op and the post-op results are validated. So that's kind of the use case at a high level.
That's very impressive, actually. The thing is, we have a pre-operative tray readily available where we would be using it because it will be in a sterile condition. But whereas coming to the post-operative, most of the gauze pieces that we use, most of the cotton swabs that we use, we discard generally into the bin. So we might probably not be able to kind of capture a photo of it because it is all disorganized. Like it will not be organized like how it is there in the pre-operative area. So my recommendation to you would be probably we should think of an alternative in terms of how do we actually capture, how do we actually count the number of gauze pieces, number of gauze pads and all of those. But whereas instruments, yes, because instruments we will not be able to discard. We'll have to send it for re-sterilization. So definitely, if we are able to address this, it is a very much value addition for any organization. So we will be very happy to help you out and work out with you all, sir.
I appreciate that. I'll take you up on that.
Thank you.
Thank you.
Next, I request Mr. Shams to take over.
Good evening, everyone. Today, the whole session basically focused on precision medicine, and most of it is revolved around data. Generally, for any innovation to be sustainable, it has to pass through three mechanisms, that is data, connectivity, and trust. Throughout the whole session, we have spoken a lot about data and connectivity. And I'll talk about the trust factor. And trust is built through a proper security channel. This is where our product, Shieldbox AI, comes into picture. This is during my graduation days, that during the time where malware, viruses have been ruling the charts, with the traditional models who would be able to solve the surface level viruses, we went deep into it by introducing DLLs, that is dynamic link loadings. This looks pretty technical, but the idea that we have proposed is little different from the firewalls. Firewalls, they check the pattern of the IP addresses. If there are any unusual flow, it will counter it. So they are totally based on the pre-trained or pre-instructed material through which it will attract anything. But our Shieldbox AI is little intelligent, and what it does is, based on the behavior of the device, let's say for example an MRI or a ventilator or anything, if an MRI goes through an unusual flow of data, then immediately our product will detect the abnormality and will resolve the anomaly. And this idea has been approved by MSME. We have presented to it, and among 15,000 ideas, our idea was approved in April. And we have built the dashboard on how we take things forward, and we want to make it more contextual by bringing in the medical data. Because when cyber attack happens to any organization, it will affect systems, operations. But when it attacks healthcare, it will affect patient care. So that is where we brought in Shieldbox AI, and we want to propose more pilots across healthcare sector to bring in more contexts, so that this shield would be more intelligent enough, and the dashboard would be so seamless that any ordinary admin would be able to understand that there is an unusual flow in the current connected devices within an operation theater, and it will immediately stop the flow towards it. This is it about the product.
Very nice. Actually, when I was interacting with him, I had few questions for him. So I was asking him, would it actually send a real-time notification to the end users?
That's the crucial part, because with respect to firewall, it's quite technical. It would not give any sort of notification. It just blocks the pre-existing instructions given to it. But in our case, you would get an immediate notification that this particular device is compromised. Let's say if a particular operation is ongoing, and during that process, if a device got compromised, then the notification has to be quick enough that they would come and replace the device immediately. Otherwise, that would affect the patient.
So this would actually help the hospitals take a real-time decision in terms of who is that person who is attacking our software, and how do we actually block it immediately. Good. So next I would request Mr. Sridhar Garu to take over.
Do you have any flashing the presentation of us? I know we have very less time, so. See, around the world, the problem remains same, be it in India or US or rest of the world. We have enormous data, but we over-dependent on pharmacists, researchers, and operations team to decide and make decisions out of the data. We have something very different, which is not the AI which can generate small recommendations, but we have AI, digital workers, which can drive your outcomes. So we have more than 40 digital workers with so many AI agents spread across functions in the healthcare industry. Today we are going to showcase 4 of them. So let me start with clinical deterioration prediction digital worker. Very important function of the hospital is ICU. Now, how does anything AI can do for ICU patient or maybe the teams over there working? Yeah, we have a digital worker which can be a differentiator between life and death for a patient. So our digital worker called clinical deterioration prediction. And when it comes to the early warnings in the ICU, when you look at the screen will have some of it. And there is a laboratory where they have a data. And you have a physician, you have some data. Data is scattered across. With this scattered data and also the history of various other elements, you will not be able to predict it manually what will happen to this patient after 2 hours. Now with our clinical deterioration prediction digital worker with the specialist agents, we will be able to tell what will happen to this patient in next 2 hours. Much advanced than the traditional systems. Okay. Then let me go to here with this case, we able to reduce the mortality rate by 8%, which is proven in the market. Now we'll go to the second digital worker. We have it in the available working currently. Clinical trial matching. So the biggest challenge in the healthcare industry is how do you recruit the patients? Not that we don't have a data, we have enormous amount of patient data. For example, in the US, 173 million records are in place. In India, maybe hundreds of patient records are in place. But the problem here is, despite having so much of data, we still see that at least 80% of our recruitment fails in the clinical trials. We have a specialist digital worker who can drive this entire process, identifying the right patient and also recruit the patient and ensure that the formality is properly completed. So in the particular case study, our digital worker able to recruit 196 patients versus 20 patients manually done by the traditional process. Okay. Yeah, there's a lot of saving in terms of dollar, close to $12.6 million saving in the particular clinical trial. Same way we have, I'll take another minute. Same way we have genomic variant interpretation. I think it is something, billions of data available in the system in terms of DNA, in terms of 3.2 billion pairs of DNA, which can sequence into millions of mutations. We don't know what is good, what is bad. Humanly, it is impossible to get the outcome out of it. But however, we have a digital worker which can process this data in 3 minutes versus 6 to 8 hours manual work in the US, or maybe the traditional tools available in the US. In India, of course, it can run in weeks. We have this digital worker which can run 3 minutes versus days versus weeks in the system. Then we have a predictive workforce orchestration where it is able to predict the workforce needed and able to do the validation of their credentials and also ensure that proper compliance is in place. We at Nexile Technologies, we have more than 330 digital workers spread across the industries. We have more than 2,800 agents, and we have a studio. Means it's a factory which can produce the digital workers. So in this industry, I think we have enormous case studies been in place. So anybody wanted to see more details about this, how this works, kindly visit our website. Website has everything, nexile.com. Thank you. Thank you for your time.
Thank you so much, Sridhar Garu, for your lovely presentation. So, my recommendation to you for the first digital worker use case, in case if we can integrate this clinical deterioration prediction along with clinical decision supporting system, that would actually really help the workforce to be used very efficiently, which will lead to overall operational efficiency and better clinical outcomes for the patient. Suppose patient is having a fever spike of 101, and we observe a trend of 11,000 or 12,000 WBC counts, where it would actually recommend red flags to the physician before starting his rounds in the day. Hey, you have a patient, this patient had fever spikes of 102, 103 the previous day, and his WBC counts are raised. Why don't you plan to send WBC counts today? Why don't you escalate the antibiotics? Why don't you send blood cultures and all of those? And coming to the predictive work for orchestration also was very impressive because every hospital runs differently, and at different times in a day, the requirement of the workforce would vary. So especially if you take our hospital as an example, because this sits in the center of the city and we are nearer to the software economic zone, we have roughly around 1,200 to 1,300 OPD patients walking in per day, and around 80 to 100 health checks happening per day. But whereas if you see on a Friday, Saturdays, the health checks would range sometimes between 150 to 200, and the highest that we have catered was around 450. That was the top that we could reach to. So in case if I have this kind of solutions readily available as an administrator, I will be able to deploy more number of staff. I'll be able to efficiently manage the shifts. So definitely I would love to explore your solution in detail, sir.